So welcome everyone. I'm Michelle, your moderator for the private Facebook group Living Alone and Connected with Catherine. I'll let her introduce
Consuela.
herself.
Hi
Um,
everyone. I'm co-moderator, content creator for Living Alone and Connected, and also the supporting people living alone with dementia group.
and today we have a special guest, Consuela Marshall. And we're going to have a conversation with her about fall prevention and safety in the home as really a more general topic, but with her very specialized insight and expertise around fall prevention and from her background as an occupational therapist, which I will let her speak more to, but also just making the home a place of safety and independence, which is important for all of you that we talk to and work with because we want you to be safe and independent in your home for as long as possible. So I will let Consuela tell us about herself, how she got started with finding a foothold, and that story, and then we'll go into some discussion and questions about the topic. So, Consuela, take it away.
Well, thank you, Michelle and Catherine. I'm so excited to be here. And as said, I'm Consuela, an occupational therapist for nearly 30 years. And a great deal of it is going into homes, working with individuals who have had an injury, have a diagnosis, or just a illness that has impacted their ability to perform the basic activities that promote a healthy life. Those basic ADLs, those activities that we all do. When an injury or an illness interrupts that, and occupational therapy can be very instrumental in restoring those occupations of life that we
Mhm.
all have in common because we all have to go to the bathroom, we all have to eat, we all have to take a bath, we all have to do oral hygiene and household tasks. And those things that I'm mentioning are called occupations. And when those are interrupted for whatever reason, occupational therapists look at the underlying problem and look at how to restore those functions through rehabilitation, changes in the environment, and how to bring about the ability to resume those tasks, even if in a modified way, because the outcome that we're after is improving the level of independence of an individual. So that's what occupational therapists do. And I started finding a foothold because I saw a need for assisting individuals outside the traditional medical model, where there are so many gaps into what the limitations are from a medical model base
Mhm.
that leave a lot of individuals compromised because they don't know how to get the help that they need. So finding a foothold became an avenue to provide that individual um, one-on-one uh,
Mhm.
training and education, as well as starting a foundation that
Mhm.
address other barriers in underserved communities where there's just a lack of education and a
Mhm.
lack of the presentation of culturally relevant information that people in underserved communities can relate to. So in finding a foothold, I try to package all of my OT skills that encompass those ADLs and fall prevention to try to bring that message to individuals outside of the medical model and inside the medical model, because I
Mhm.
still do home health. I still have contracts with hospitals. So that's finding a foothold, and it led me to writing a book that sort of tells stories about those gaps and about things that individuals can do specifically in fall prevention and
Mhm.
how to make changes in their behaviors and in their environment to reduce those fall risks.
Yeah,
Mhm.
I love that. And I was thinking about just what a good name it is, finding a foothold, because sometimes bridging that gap from hospital after an illness or hospital after an injury or doctor after a diagnosis, bridging that gap from that medical model, like go home and take these pills and go home and do these exercises, to home, where now like the foundation's been shaken a little bit with the new diagnosis or whatever. And so the home isn't just home anymore. Now it's like, how do I stay safe here now that my foothold is, and how do I find
Right,
like that foundation,
right.
instead of just we now immediately we go from the hospital to a nursing home. So that, at which is that's not the case, right? But there is still a learning curve,
Yeah.
uh, about learning about making your home
Oh,
a
absolutely.
little bit more like the medical model, but it's still your home. Or if you're bringing in
And
home health,
then,
you know?
the medical model can feel so sterile.
Yeah.
It looks sterile in the way that everything is in its place.
Yep.
Everything is clean and shiny. Everything has been
Hmm.
sanitized. Everything looks uniform, even on the pictures and on
Right.
the when you're in that medical model. But me going into home health for years and seeing homes don't look like that, or
Mm-mm.
everything is not ADA, and for ADA is not relevant in the home setting anyway.
Right.
ADA is a commercial standard, but just no, sometimes making that transition from learning in a medical setting to putting it
Mhm.
into practice in the home environment takes home health can do parts of it, but there are just unique things in home settings that you don't get in a textbook. And
Mhm.
you even go into other communities that are not as fortunate to have the basics, and
Right.
getting them to see there are things that you can do, that it doesn't have to look sterile. Let's just make
Mhm.
it look relevant and pertinent to your environment, and giving them ownership of choices that they can make within an environment that does not look typical.
Mhm.
It's empowering to them that, yeah, I can do that. I can use something uncustomary that you cannot recommend in the medical model, but you're like, look, let's just put this right here. We're going to use
Right.
this for this, and that's going to work just fine because Medicare doesn't pay for this. Nobody's going to, do this or install this or
Right.
remodel this for you. So look, let's just make this do. So when you're in this room, this is how this needs to look for your environment. And I love doing that, that people say, I can make a difference. I can do things. I don't have
Yeah.
to stand back and do nothing because I can't follow a certain projected image or method
Mhm.
that's presented, but that we can look, let's just see what we can do with what you have and in the circumstances that you are living
Mhm.
in. And I love that part of it.
Yeah, it's so personalized because it makes me think of when you talk about baby proofing a house or toddler proofing a house or kid. And if your child isn't interested in electrical sockets, but they're very interested in the stove, you want to spend more time accommodating and baby proofing the area around the stove and maybe not worry as much about. Now, again, this all depends on the child, right? But it's just
Exactly.
that idea of individualize. Where are the areas of need? Where are the areas where your independence has been impacted by the illness or injury? And how can we come up with some creative low tech? It doesn't always
Right,
have to be a high
right.
tech tool.
Not even
Um,
right.
yeah, so that's what I would love for you to talk about that next, if that feels right to you or a good segue. Like, what are some of, because when you said uncustomary, I was like, oh, I would love to hear some of like her best examples or some of her favorite things where it's a tool that you would never know that that could be a good fall prevention or independence booster in the home.
For individuals who don't have the means to buy a grab bar,
Hmm.
or they're in
Yep.
tight quarters where if we had a grab bar, I don't even know where to put it because
Hmm.
it's just the structural
Correct.
aspect of the house. Um, One thing I have recommended to a patient that just needed something to pull up on, to
Hmm.
hold on to, but we couldn't get a grab bar in that space, um, was something like a screen door handle pull, like something just as small as
Hmm.
that. We
Hmm.
just needed that much of place where a hand could
Yep.
get go in, that
Yep.
we could put in a strip of wall between some molding from a door this way and a door this way. They had that little strip. I'm like, well, we can't put a grab bar right there, but if you can, because she was pulling up on a doorknob on a closet right in front of her to get off the toilet. So of course we elevated the toilet by
Hmm.
getting a riser and we got the armrest, but she still just wasn't too steady once she stood. I'm like, you need something to hold on to while you're pulling your pants up, or you're doing things and standing. And she
Hmm.
had that gap of space between the door into the bathroom and a closet that was right in front of the toilet, and there was no way to put a grab bar on the on that door,
Hmm.
because the door was very wasn't substantial. It was a hollow door that we couldn't put a grab bar on the door, but there was that strip of space. I'm like, don't think I'm crazy, but let me give you an idea about something your husband can probably do, because we don't
Hmm.
need to hire a construction guy to do all of that. Look, we just need something that'll fit in there. And I'll just stop for a minute. I'm like, look, y'all know what a screen door is? Like the old fashioned one that's slammed, or just anything, but you can picture that little thing that you pull. I
Yep.
said, if your husband can go to the store and buy one of them, and
I
actually
love it.
looked it up online. I'm like, that is $2.97.
There
Get
you
his money
go.
back, and we're going to stick that right here. So as she gets up off the toilet, and I figured out where it needed to be. Her husband drilled it right in there, and it was perfect. It was something that she could hold on to. And her husband said she was always put her head on the door and lean and try to pull up, or
Wow.
this. It was like little things like
Yep.
that you
Made
really
a
can't
huge
take a
difference.
webinar and learn that. Or if you went to a fall prevention, these great things that are out there, and I love all the evidence-based things out there, but sometimes you just have to be creative.
Correct.
You've got to just be able to think outside of the box. So
Hmm.
the things that I've just the experience that I have that allows me to think through these things, it
Hmm.
just really helps people to see that I can stay here, I can do this, I can be safe, and what other things, then they
Hmm.
become hopeful that, I can keep mom at home longer, I can keep taking care of dad longer, because that one activity became so much easier for them. It lowered the stress level on the caregiver,
Yes.
and
Yeah.
it increased the level of pride and independence that person is having, in that they can now not have to wait to call their husband to get them off the toilet
Right.
when they're finished. And just having that increased independence
Hmm.
is just a byproduct of it. It's just
Hmm.
being able to improve their level of independence.
I love that. And I think that's such a great example for our groups that we work with, because we have people that are living alone, but they may need some kind of support or assistance there. And
Yeah.
it might be something as simple as that or something like it.
Mhm.
Um, and I think it's also important for caregivers to realize that sometimes all it takes is just these smaller intentional modifications in different spaces throughout the house that can make a huge difference in independence versus dependence. Like you don't have to jump at the first fall
Mhm.
to get somebody moved out of an
Yeah.
independent living
Yes.
arrangement into a supported living arrangement. Because I will say too, from having worked in those environments of assisted living, people can have a fall there too, or
A
people
whole
can
nother set of problems.
get stuck on
Right.
the toilet and not be able to pull
Yes.
themselves up there as well. So it's changing
Yes.
those mindsets around. what independence looks like, what supported living looks like. They don't always have to be, well, supported living is only in this environment and independent living is only in this environment and under these circumstances. So I think that's a great example of where, like
And
you said, it takes the stress level of the caregiver down, knowing that mom isn't going to pull the wall out or pull the
right,
closet or pull herself into the
right,
closet when she's getting up
right.
off the
Yeah,
top.
so pulling onto a towel rack that's not installed to carry that
Right.
pull and that weight
Yeah.
that's put on it, and it could result in it a fall because it all
Hmm.
comes undone from the wall.
Yeah.
When we're talking about the diagnosis of a dementia, a cognitive
Mhm.
deficit, when we're looking at fall prevention, um, we it does take another level of creativity when
Yes.
recall is not at play as far as recalling certain things, certain elements that or techniques or strategies to prevent
Right.
falls, but getting the instruction or getting guidance on what to put in place.
Hmm.
um, If you put a grab bar next to a bed where there is a tendency to fall or where there has been a fall, when a person sees a grab bar, you're going to automatically hold on to it.
Right.
It becomes that person's extended hand
Hmm.
that would reach out and say, let me help, I'm here to help you so you can keep your balance while you put your shoes on or your pants. So you like finding out what are ways to modify what is the barrier to independence and safety with a particular task. So if we go to just um, dressing at the bedside level, where does the when and where and why does the caregiver have to enter the picture?
Yes.
And what can we do in the environment to put in place that structure and that support that is
Absolutely.
not the caregiver? So what would we look at from an OT standpoint would be, let's lower the bed. The bed is a little bit too tall to be sitting on the side of the bed putting your pants on because you can slide off. So
Right.
then you add an armchair next to the bed. Then it's gonna automatically become the place you sit to put your clothes on. And you
Hmm.
can even say, sit to get dressed. And that then you sit there and you can put your pants on, you can cross your legs, tie your shoes, versus trying to do that from a taller bed. And
Hmm.
so you have to really look at, and a trained OTI is good, but
Hmm.
a caregiver don't underestimate what you already know and why you enter the room at a certain point of a task. You already know where the weak links are.
Correct.
That's why
The
you
gaps.
show up. So
Hmm.
you really do know, but the
Hmm.
problem is then you take that on as a responsibility of yours, which is not necessarily the case. It just means, what do I need to modify in this situation so I don't have to
Hmm.
come put her shoes on? So
Right.
also as you living with the dementia, you don't land on the floor.
Right.
And we look, so it's like taking into consideration what those things are, where those weak links are, and
Hmm.
putting the modifications in the environment that are needed for that stage
Hmm.
in the process of living
Yep.
with dementia.
Yeah. And I
Mhm.
was thinking too of, like you're giving them kind of a visual connecting thing, like, the grab bar near the bed
Mhm.
is
Mhm.
sort of like, even if you
Right.
forget maybe what the grab bar is or what it
Oh, but if
does,
you're standing up and
The habit.
you're
it's
gonna
that
grab
muscle
something.
memory. It's,
Yes.
you're kind of
Yes.
building on the wisdom of the muscle memory in your body
Right.
when the
Right.
physical or the
Yes.
cognitive isn't
Mhm.
there. And like you said, like when you said, don't put your pants on the bed, go to the chair. Like, so maybe in some cases with whatever the level of dementia is or wherever there are challenges, like you said, and interruptions to that once easy task,
Yes.
maybe all you need is to put a sign up that says, get dressed in the chair. And
Yeah.
that might be all you need for
That's
them
it.
to remember,
That's
get
it.
out of bed, grab the bar, put yourself in the chair, and then pull
Right,
on your pants and
right.
socks and shoes,
And
etc. I
it
mean,
will,
and a lot of
yes,
kids on the spectrum or other, there's other places where people
right,
have cognitive
right.
gaps, and visuals and
Mhm.
schedules and prompts
Exactly,
can be extremely helpful.
exactly.
I have
Mhm.
a quick question for you. So I noticed that my parents who are in their 70s and they don't even have dementia or anything, sometimes they'll leave their shoes in places where I'm visiting or something. I'm going, this is a trip hazard, like put all
Yes.
the shoes here in this one spot. And it's like a habit that isn't working gets me a little concerned. And also, not everyone has a perfectly tidy house, especially I think sometimes with dementia, clutter can build. So
Mhm.
I was just wondering in terms of, do you
Great
have
question.
any tips to kind of prevent or start to move away some of these trip hazards that might just come up?
Yeah, I mean, overall, just in aging, anybody, there are do's and don'ts. And keeping walkways clear is one of the top ones that I always talk about. Adding adequate lighting in the home, wearing proper footwear. So, regardless of the diagnosis, if you're blessed enough to be aging and uh, in that older adult category, they're just basic things that you need to know about. And what you're mentioning is that. And but where I would differ somewhat is not telling them in how you tell them, um, and giving them liberties to say, well, choices. You don't have to keep the whole house tidy because I can say none of us do. But look, when you take your shoes off, just don't put them here. You can put them anywhere else. They don't have to go back in the closet. They don't have to be in a cubby. They don't have, but please don't put them here. That's a little freeing than a mandate, to do something so strict and strenuous that uh, it makes them, it pushes, it gives some pushback when you take away some autonomy. Just saying, oh, mom, just when you take off your shoes, just put them over just a little bit right here. So really, it's just respecting that person, allowing them to know what options are available. What is something that fits their lifestyle? And allowing them to be part of the decision making uh, in regard to reducing risk and increasing independence. And even we're living with a dementia. People have desires and wants and habits that they you don't get rid of all of that. It's like in those opportunities, in the moment is sometimes best, but sometimes in the moment, just let it ride through and let's go back and talk about this later. It's just like, okay, earlier I noticed this, like, what's a better option? You want to do that or you want to do that? And just sort of working through little things as you see them, just starting with the biggest fall risk first, whether it's the tub, which is often a place, common walking areas, and in the way of rugs and things, and just giving them input, like where can we put this rug instead of here, and allowing them to say where instead of taking a rug and throwing it away, or it just depends on that person and the level they're at. But in as much as you can get them involved in the choices, it does matter. It does.
So I was also wondering if someone with dementia is visiting a friend, a family member, they're in a new home, a new environment. Is there any tips for the person who, not for the person with dementia, but for the person they're visiting that could make the home a little bit more dementia friendly? So they may not have bars or anything like that, but is there something they could possibly do, even if it takes a few days or 5 minutes, to make it a little easier to navigate that new environment?
First of all, the education that I mentioned earlier, that goes for everybody. Do that first. The throw rugs, the look at how tall or low surfaces are. You want to go through all the basics. just being mindful, just being mindful. This is what I often say to people who go visit and stay with their daughter for a week every summer, or
Mhm.
you're visiting and you go to your daughter. She lives in the same city, and you spend the day over there. Um, if you're the older adult and you're struggling in an area in the home that's not yours, you need to speak up in the way of, like, you're staying in the granddaughter's bedroom and it's pink, it's all the little flu things. You don't have a designated bedroom. They just put her on the sofa while you're there for the week. But you don't feel, you struggle even to get your legs in and out of bed because her bed may be taller. Or in the bathroom, you're like praying I don't have to go because I may not get off of that little toilet. All of those things can lead to falls. So just having those conversations, so there's some prep work prior to the visit.
Mm.
Because as a therapist, I've seen many patients, and one not too recently, I'm like, okay, how'd you fall? I said, what happened? Oh, I went to my daughter's house and I fell in the bathroom. And then the daughter's in the room like, Mom fell at the house. I feel so bad. She came here for a vacation and now she had surgery in another state. She's in the rehab in another state because the prep work wasn't done in preparation. It's just having a keen awareness of knowing what that person's limitations are before they get there. You've been to their house, so you know there's some things in place, or you see the struggles, or you see the more difficult things, and then you want to make those adjustments in your house. It's temporary, so you're not doing anything extravagant. But what does it take to put a bed rail, a little thing you can buy from Walmart for $40 that slides between the mattress and the box spring that you can temporarily attach to your that bed so they can have something to pull up on? What is a riser that you can put on the toilet while they're there in the home? If your bathroom door is so little that they can't get the walker in, can you get a second walker that stays in the bathroom, that they leave the other one in the hall and they just transfer onto the other one? Just so these little things that you can do more so, and I'm thinking more orthopedically wise, but when you're talking about dementia, you want to like if they're staying just for a visit, just doing a quick scan and seeing what are things are unsafe that may be misconstrued as being something that is not. And you want to just sort of declutter, get things out of the way that, could be hazards, choking hazards, things of that nature prior to that visit. And just sort of decluttering the space that you are going to be in. If y'all are there for lunch, get all that stuff off the table. Just simplify things and ask the questions, and do the research, just in the same way you would do a research with something else or somebody new who may came coming over that's had a stroke or have some type of diagnosis. You're going to like, okay, what do I do? Or what are some things I should know? Well, the same applies to someone with a cognitive deficit. You have to be really considerate of that is an illness as well. It is an illness as well, and there are things in the environment to settle things, to make that person who's already going into a new environment, who's going to tend to be more anxious because this is unfamiliar. But then you throw fake fruit on the table and you've got all these you got all of this stuff in the way. It could make for a very exciting time, and they don't want to stay. They're trying to get out the house because it's just too over stimulating for them. So just doing some prep work is required to make those visits as friendly as possible.
I think that's a great point because the cognitive piece sometimes is harder to see, like, um, and so having those conversations ahead of time, like what kind of things have you been struggling with lately in the home, or just being curious and like you said, doing the research and not just assuming that, but just those things that can be overstimulating, you can't always see that happening. You can't necessarily see the anxiety. Maybe you can in body language. Some people are more perceptive about that. But just to remember that fall prevention isn't always about what you can see, or that sometimes there is a connection between physical clutter and then causing some kind of internal clutter and agitation, and just kind of thinking outside the box, or making those connections between what's internal and what's in the environment that's, contributing to that overstimulation or like noise. I mean, some people maybe just get really overwhelmed with a lot of 10 conversations going on at once. Can be
Mhm.
harder for someone with
Exactly.
dementia to filter out the conversations that are not relevant to them. It can be harder for them to stay focused on the person in front of them when there's a lot. So just being aware of, and sometimes those things can cause falls. Like we think of the obvious, like remove throw rugs, which are a hazard. And please, if you have throw rugs, get rid of them. But it's also not just grab bars and throw rugs that are fall prevention, you
Right.
know,
Yes.
efforts. Sometimes it's about making sure they're not overstimulated or getting dizzy or off balance from too many people, too many things, and then they fall just because they're overwhelmed. Or they're in a guest house, like Catherine said, and they aren't used to having to account for moving around a couch
Mhm.
and in a certain way. I remember sometimes we would move furniture in the house, and I realized how my daughter would get so used to things being in a certain space that sometimes she would trip over something that wasn't even there, just because she had kind of made her own code of working around in a room that I wasn't aware of. And then an object that she was used to avoiding was suddenly not there to avoid, and she almost tripped from the lack of the object being there. So again, I think that's why it's important, like you said, to just have kind of a low pressure but compassionate conversation about how can I help you with where you're at right now, rather than making all these preparations that mean nothing to the person given, where they are or how they move in the space. And also just you can check in with them during an event or a visit too. Like, yes, do some prep work, but you also might not know until they get there and until there's more people arriving in the environment, that can also change things. So just a simple like, hey, how are you doing? Is there something, or the
Mhm.
lights bothering you? Or with sundowning, as the sun goes down, people get agitated. Is there a way that we can bring the lights up? People at a party tend to dim the lights at a certain hour to kind of set that mood. But for someone with dementia, that could actually be really triggering at that time of day to dim the lights even more. And then, lighting, as you said, is a big part of fall prevention too. So yeah, it's kind of just thinking beyond like the obvious in some ways, to making some of the internal
Yeah.
challenges of
Just
cognitive.
observant with how they are
Yeah,
responding
right. Reading their body language.
and keeping it small to begin with,
Yeah,
just with them in the new environment in itself creates or can create a level of anxiety, and
absolutely.
just allowing for those small, more intimate gatherings or
Good.
spaces that they can go and separate for a little while.
Yeah,
But
so
this
I'll tell
was
her.
great. I appreciate it.
I
Awesome.
I I always learn something new from these conversations, and I learned a lot of
Yeah.
this today. So I
Yeah.
Okay, thank you.
Thank you.
have a good afternoon.